Topic 1. What kind of information is included in a patient's medical history? Why is a medical history important? It allows doctors to identify patterns and make more effective decisions and right diagnosis. This information gives a doctor all kinds of important clues about what's going on with patient health, and also tells him or her what health issues the patient may be at risk for in the future. A medical history is a record of information about a person's health. It includes presenting complaint, current symptoms, past medical history, previous medical problems, social history, patient personal habits and lifestyle, family history, conditions run in family. How do doctors use medical histories? Doctors use medical histories to gather or collect information or data. The data will uncover likely causes of the condition, make proper diagnoses. What is past medical history? What does a good social history include? What does family history include? Topic 2. What are some duties of a family practitioner? 1. Provide a variety of healthcare services to all patients, regardless of age. 2. Treat injuries and illnesses. 3. Provide preventative care such as routine checkups and immunizations. 4. Counsel patients about their healthcare options. 5. Advise a recommended course of action. 6. They are a vital source of health education. 7. If needed, family practitioner refer patients to specialists for specific diseases and injuries. 8. Even though they don't work in an emergency room, many family practitioners provide urgent care to patients requiring immediate attention. Other answer. 1. Provide comprehensive care to patients of all ages and genders through all stages of life. 2. Oversee preventive care. 3. Manage common complaints or chronic illness. 4. Diagnose emerging conditions. 5. Refer the patient to a specialist if the condition becomes serious and requires a more concentrated focus, but they stay involved and informed. Question. 1. How important is the family kind in the healthcare system? 2. Who do family practitioners refer patients to for specific diseases? 3. What is primary care? What is family medicine? Urgent care? Topic 3. How do doctors become qualified to practice medicine in Vietnam? In Vietnam, as well as in some countries in Asia like India, China, medical schools don't require pre-medical degrees. First, students must pass entrance examinations before admittance to ensure competency. Then, medical students must complete a 6-year medical degree. After graduating, most doctors choose further training or qualifications. Excellent students can get a 3-year residency about their majors. Other graduates can work in hospitals, medical settings for some years, and then they return to medical schools to have master degree, first degree specialist, fellowship, PhD, philosophy. Why do medical students need extensive education? Because medical students learn a subject that is vital for the health of communities. So, they must be prepared to protect the health of the others. Medicine is a vast and complicated subject of study and comprehensive education. This subject will help doctors have solid knowledge of how the body works in order to treat a wide variety of medical conditions. Other answer. To practice medicine in Vietnam, a medical student must 1. Complete 6-year training at a medical school. 2. Have a 18-month practice in hospital. 3. Have a health certificate. 4. Get a medical license. In the UK, a medical student must first complete a 4-year bachelor's degree before going to medical school. Most students earn a medical degree after another 4 years and then undergo a residency to get advanced training in a particular field. Finally, he or she must pass a medical licensing examination to become a licensed doctor. Topic 4. What are some risk factors and complications of diabetes? There are many risk factors associated with diabetes: genetics, race, a high BMI, body mass index, HTN, hypertension, a diet that is high in fat or alcohol. Hypertension or high blood pressure. Complications: diabetes can cause problems in many parts of the body including the eyes, kidneys, nervous system, sexual function, teeth, gums. It can result in heart attacks, cataracts, glaucoma, blindness, and even amputation. Some questions. What are the different types of diabetes? There are 3 types of diabetes. These are type 1, type 2, and gestational diabetes. All types of the condition reduce the body's ability to regulate its amount of blood sugar. What is crucial for people with diabetes? How to manage diabetes effectively. How to prevent the risk of developing diabetes. Risk factors. Overweight and lack of physical exercise. Smoking. A low-fiber, high-fat, and sugary diet. Medications that can affect the body's metabolism of carbohydrates. Genetic factors which may cause some families to more likely develop diabetes. Complications of diabetes. Eye problems, vision blur, blindness. Foot problems, foot infection, limb amputation. Heart attack and stroke. Kidney problems. Nerve damage. Gum disease and other mouth problems. Related conditions like cancer. Sexual problems. Topic 5. What are some different kinds of cancer treatments? There are many treatment options available for cancer patients today. 1. Chemotherapy, a drug or combination of drugs that kills cancer cells. It can be taken orally, but the most common delivery is through an IV injection. 2. Radiation therapy, a form of therapy that uses high-energy X-rays to destroy cancer cells with especially cancer cells that are splitting. It destroys cancer cells' DNA so that they can't grow, split. 3. Photodynamic therapy, a light-sensitive drug containing cancer-destroying substances. Light beam activate the drug, which has been absorbed by cancer cells. 4. Immunotherapy, a form of cancer treatment that strengthens the patient's immune system. New antibodies are introduced to the system and destroy cancer cells. 5. Ant-angiogenesis therapy, a form of cancer treatment that uses drugs or other substances to stop a tumor from budding or making new blood vessels supply blood to survive tumors. Some questions. What are side effects of some cancer therapy? What is oncology? Where can cancer appear in the body? Cancer can appear anywhere in the body, but some common sites are the lungs, breast, uterus, skin, colon, prostate, blood. How to prevent cancer. What kinds of cancer do men or women or children suffer from? What are some common symptoms of cancer? Unexplained weight loss, poor appetite, fatigue. What are some of the causes of cancer? Smoking, unhealthy food, exposure to X-rays, sunlight. UV, ultraviolet radiation from the sun, chemicals, family history. What do people do to prevent cancer? What are some diagnostic procedures to help detect cancer at the early stage? Biopsy, mammogram, colonoscopy. When can't cancer be treated? Malignant tumors. Cancer treatments. 1. Surgery. 2. Chemotherapy. 3. Radiation therapy. 4. Bone marrow transplant. 5. Immunotherapy. 6. Hormone therapy. 7. Targeted drug therapy. 8. Stem cell transplant. Topic 6. How can a person lower risks of heart disease? There are some risk factors in the development of heart disease such as smoking, high blood pressure, obesity, high blood cholesterol levels, diabetes, physical inactivity. To lower the risk factors, everyone can follow some simple steps. 1. Stop smoking. 2. Exercise regularly. 3. Get regular checkups. 4. Reduce stress. 5. Eat a heart-healthy diet. Some questions. What are some common kinds of heart disease? Coronary artery disease, atherosclerosis, and arrhythmia. What is atherosclerosis? What is the treatment of atherosclerosis? What is coronary artery disease? How can coronary artery disease be treated? What is arrhythmia? How can arrhythmia be treated? What are the general treatment plans? How to lower risks of heart disease. 1. Control blood pressure, cholesterol. 2. Stay at a healthy weight. 3. Eat a healthy diet. 4. Get regular exercise. 5. Limit alcohol. 6. Stop smoking. 7. Manage stress. Topic 7. What kind of patients are seen in an emergency room? An emergency room must be prepared to see all kinds of patients. The worst patients are trauma patients with critical and life-threatening injuries receive the highest priority. Other patients may come to the ER for less serious reasons, such as routine illnesses or minor injuries. Some questions. How does the triage process generally work? Patients go to the triage station to undergo an assessment by a nurse. The nurse will utilize the Emergency Severity Index to determine the severity of a patient's injuries and when they should be seen. The nurse will assign an ESI level between 1 and 5, with 1 being the most serious, to each patient. In this way, patients will be seen according to the acuity of their injuries. Are patients taken to A&E and seen on a first-come, first-served basis? What conditions will be taken to A&E? Or when should patients be taken to A&E? Has stopped breathing or their heart stopped? Has severe chest pains, difficulty breathing? Is bleeding severely? Unconscious or has had a serious head injury or has severe bumps? Has a severe allergic reaction? Has stroke? Has a suspected fracture, broken bone, or dislocation? Severe stomach pains that don't go away when treated with OTC drugs? Has overdosed or poisoned themselves? Kinds of patients are seen in ER. 1. Broken bones and cuts from accidents or falls. 2. Burns. 3. Uncontrolled bleeding, chest pain, difficulty breathing, severe abdominal pain. 4. Unconsciousness. 5. Food poisoning. 6. Severe allergic reactions from insect bites, foods or medications. Topic 8. What are some ways to prevent infection from spreading? There are many ways to stop infections from spreading. A hand sanitizer, water, and soap can be used to wash your hands frequently. Another way to stop infection from spreading is to maintain good personal hygiene and to keep your surroundings clean. Wearing face mask. Keep distance from each other. Washing hands. Putting in isolation. No gathering. Other answer. 1. The majority of illnesses are spread through touch, so it is imperative to wash hand regularly with antimicrobial soap, and it's essential that hospitals have many hand washing stations available to patients, visitors, employees. 2. Use alcohol-based hand sanitizers to prevent E.coli and staph infections. 3. Maintain good personal hygiene. Keep your surroundings clean. Clean all the surfaces with disinfectant. Discard mindfully all used syringes, biohazards. 4. Hospitals should try to prevent illnesses before they spread by using diagnostic tests to detect infections such as infections caused by drug-resistant bacteria MRSA, methicillin-resistant Staphylococcus aureus. Have standard processes for procedures to avoid some infections like ventilator-associated pneumonia, infection caused by improper urinary catheter. Follow cleaning procedures for medical tools carefully and don't contaminate sterilized tools. How do infections spread? Infection-causing bacteria are everywhere and they can spread quickly. Most germs spread through touch, so it is essential that hospitals have many hand-washing stations available to patients, visitors, employees. Some germs are airborne. Coughing and sneezing can cause the spread of bacteria in the air. In addition, there are many germs in raw meat such as E. coli. So meat needs to be well cooked, and we need to wash hands after touching it. Washing frequently with soap and water will help reduce the spread and infection outbreaks. What infection do hospital patients often get? Nosocomial infection. What is used to prevent E. coli and staph infection? How to detect drug-resistant MRSA bacteria? How to prevent ventilator-associated pneumonia? How to prevent infection caused by improper fit of urinary catheter? What do people do to prevent the spread of contagious or epidemic or pandemic disease such as COVID-19? What are some infectious diseases or contagious diseases? Measles, rubella, German measles, chickenpox, mump, COVID-19. Ways to prevent infection. Wash hands frequently and well or properly. Don't share personal items. Cover mouth when you sneeze or cough or yawn. Get vaccinated. Use safe cooking practices. Wear a face mask or gloves. Put patients with suspected infectious diseases in isolation areas. Topic 9. How can medical professionals improve communication with patients? Clear communication is vital to providing the best care possible for patients. There are some ways mentioned to help medical professionals improve their communication. 1. Medical staff should establish a good rapport with the patients. 2. Medical staff should show empathy and understanding at all times to encourage patients to say about themselves as much as possible. 3. Staff should be aware of how verbal and nonverbal cues are affecting the interaction. 4. Avoid using jargon as much as possible. This may confuse or intimidate the patient. Instead of saying pneumonia, you can explain to patients about inflammation of lungs. 5. Ask open-ended questions to signal to patients that you care about their input. Can you tell me about your pain? Is open-ended question. All medical staff should share some ways of effective communication with patients. The more information we give and receive, the better care we can provide. What are some possible causes of miscommunication? Poor health literacy. Uninformed patients may not understand important terms. Negative preconceptions. Patients may not trust medical professionals. They may experience anxiety when forced to interact with them. Cultural differences. Different cultures may have different approaches to dealing with illness and healthcare. Topic 10. What personnel are involved in surgical operations? Surgeon performs the main tasks and assisted by a large staff. An important member of the surgical team is the anesthesiologist. This specialist administers the anesthetic that renders the patient unconscious or insensible of pain during the operation. There is usually one assistant surgeon or two interns or residents. The chief operating room nurse supervises operating room staff nurse such as scrub nurse, in charge of surgical supplies and equipment, a circulating nurse, in charge of activities outside the theater, an orderly, help move the patient. What are some tools used in surgical operations? A variety of tools are used in surgical operations. Scalpels are one of the main tools. Clamps and sutures are also used.